first, though, is Freedom Mini Dental Implants. We've got Dr. Regan Ackerman back on Listens Live. And as always, it is a pleasure to have you to talk about what you're doing. That's so cool in your office these days.
Yes, thanks for having me on this chilly day.
Yeah, and it's only going to get chillier, yes. And that's important to remember. But for you, we see it all the time. You always bring the models to showcase what it is that you do. But yes. From 30,000 feet, tell me what it is about Freedom Mini Dental Implants that makes it different than some of the other surgical procedures that you may need to have done in order to get that smile back that you've always wanted.
Yeah, certainly. So the difference with the mini dental implant is that it's just a smaller diameter, less invasive implant. So a lot of people that were told they weren't candidates for surgical implants, you know, a lot of times I'm able to help them out with the mini implants. Either do a single tooth, snap their denture onto the implants, or get rid of the denture completely and do what we call a roundhouse bridge. A lot of people have been told, you know, maybe they lost their teeth because of periodontal disease or bone loss, and maybe they have to have major bone grafting. A lot of times I'm able to help people out with a much less invasive, smaller diameter implant, and usually a lot less costly and less time consuming than the bigger surgical implants.
And it makes a lot more sense when you look at the actual holes that
yes,
you're talking about putting
yes.
in people's bones in their mouth.
Yes.
And you've got like the jawbone here. You can
perfect.
Really see just how big of a difference that makes.
When we're doing a consult, which I do free consultations, there's no charge for the consult. I always explain the process. And when I show this model, it just speaks volumes. People are like, oh, wow. So I am not making this big hole that you can see. When they do this, you know, you have to have an incision. Sometimes it has to heal for, you know, months. So I'm going to cover that up. And there is a small hole here, and that is what we call the little pilot hole that I have to make. Numb you up, local anesthetic. I do not have to do sedation. My patients can drive themselves to the appointment and drive themselves home. I place this small little pilot hole and then place the smaller diameter implant. So no incisions, no stitches. And I think this also shows how I don't have to have a lot of bone, just some bone to be able to place the mini dental implant.
And that just makes things easier from start to finish. You're talking about the procedure itself is easier, less invasive, but afterwards too, the recovery time, everything from start to finish just a lot easier.
Yes, I had actually one of my favorite patients came in this week for his post-op. We did an upper denture stabilization. So I placed all his implants a week ago, and he left that same day with his denture snapped in. And when he came back for his post-op appointment, he was like, it was great. I went to work the next day. I, you know, had minimal pain. It was great. So we hear stories like that all the time.
And the stories we not only hear, but we get to see them often too. You've shown so many examples coming on here in the past of the different people whose lives you've helped get back to a place they want to be, because the smile does mean so much to them. And I also want to show what those look like. It looks like you've actually got an extra model here today. You usually bring 3.
Actually, you know what? Let's go over that real quick, okay? Because it kind of started a new process. This is what we call detachable bridge. We do snap-in dentures a lot, but this is a roundhouse. It's a bridge. So you get rid of the denture, so it's just the teeth. It's made out of a much stronger material. So when I place the implants, a lot of times we were doing the cemented ones permanent, but some people wanted the option to be able to still take out that bridge to clean it. So this snaps on. But the patient, you don't take it out every day. You brush it, normal, you know, toothbrush, toothpaste, but then you have all the roof of your mouth back, and then you come see me every 6 months, and I'll take this out, rinse and clean everything, and then snap it back in for you. So it's a really cool kind of, not new procedure, I've been doing it for a while, but just kind of now showing it.
And it looks a lot like the permanent dentures that you've talked about before.
It's just removable now, because some people didn't like the idea of having something cemented. They want to be able to take it out and clean it. So this is a great option. And, you know, everybody's, you know, personalities is different. And that's what, we're a small office, not corporate. It's me and my husband and one other employee. We do free consultations. So if you know somebody's struggling with dentures, if they're using tons of denture glue, or they're not wearing their bottom denture anymore, or they're, you know, missing a tooth, please have them call, because it's a free consultation. We'll go over everything. I'm the only dentist there, so you'll see me go over the process and cost and how I can help you out.
Yeah, the number's there on the screen, 502-937-4930. Dr. Ackerman and the team over there will definitely make sure that they're working on a cost-effective and really just all around efficient process to make sure that you're getting your smile back. You've also got the other options. You talked about the removable bridge. You've also got the permanent one that you've talked about, that you cement in there, it doesn't move. But then you've also got the other one. So you've the removable dentures, and a lot of times what happens is you take someone's dentures and then you just make it work.
Yeah, so this is probably one of the most common things I do, because so many people are out there struggling with dentures. You know, they like the way their denture looks, they just want it to stay in better and not have to use glue. So this option, and sometimes I can use the same denture and save costs that way too. So place in the mini implants, just local anesthetic, no incisions, no stitches. And the day I put these implants in, same day, I will put these attachments inside your denture, and you will leave that day with the denture now snapped on to the mini implants. So then no more denture glue, no more floppy denture. You wear it 24/7. You can snap your denture out once a day, rinse and clean everything, and then snap it back on. And a lot of times too, on the top, you know, if you can't wear your denture because it's gagging you, once I get those implants in, I can trim that back off the roof of your mouth to help with that gaggy feel as well. You
know, we've got maybe a little over a minute left here, but you do have one more model, and that's something too that's interesting, because you don't have to always do your entire mouth or the entire row. Let's say you've got some sort of maybe physical trauma to the teeth. You can do one at a time. You could do 3 in a row. Explain that to me.
Yep, I had a patient this week missing a canine tooth and placed the implant. She left with a temporary tooth on that day, but instead of having to wait another 3 to 6 months or a year with the surgical one, she's going to come back and see me about 4 to 5 weeks later. We'll have the nice, pretty permanent tooth made out of that strong material. It gets cemented on that tooth, on that implant, and then she's essentially grown her tooth back, basically. So yeah, we do single teeth. You might be missing, you know, your molars or your chewers back in the back. We can do 2 or 3 teeth at a time. There's so many different ways that we use these mini dental implants.
You can get started with Dr. Ackerman by visiting freedomimplants.com. The number's on the screen as well, 502-937-4930. Give that number a call. Dr. Ackerman, thanks for joining us today on Listens Live.
Thank you.